Hi guys, so this is a really short lecture on motivational interviewing in the context of medication adherence. So you guys have already had a lot of motivational interviewing in Skills 2 when you talked about it within the context of smoking cessation. So if you don't remember, go back and look at that material. So this is really just going to be a reminder of motivational interviewing techniques, especially within the context of medication adherence. So I recommend that you watch the medication adherence video that Dr. Rogan narrated, watch that PowerPoint slide set, and then come back and watch this video just so you can get an idea of the context within which we're talking about. So we'll talk about medication adherence and how you can use motivational interviewing to improve medication adherence. Okay, so I'm going to share my screen here. Give me a second. All right, so we know that medication adherence is an issue. So, when you think about medication adherence, what does it mean? It refers to, taking your medication in the right amount at the right time in the right way for the right duration. So there's a lot of kind of complexities, when you think about medication adherence, right? So it's not only just kind of, remembering to take your meds, it's also remembering to take the right amount. It's remembering to take them at the right time. And so there's a lot of kind of nuances to medication adherence, and there's a lot of reasons why patients might not take their meds on time. So it could just be, or take their meds correctly. And it could be that they are forgetting. It could be that they don't even know how they're supposed to be taking it. They don't have the education. Nobody counseled them. It could be that they're having difficulty with taking their meds because it causes side effects, or they have physical impairments that are preventing them from being able to open the vial, being able to give themselves an injection. So there could be so many reasons for medication issues in medication adherence, and those are what you really kind of need to elicit from the patient so you can really help them. In terms of extent of non-adherence, this was a while back. This was published in 2010, but I imagine that the data is still going to be very similar. So for every 100 prescriptions that are, written, only 50 to 70 are actually filled by the pharmacy, which means that, possibly 50 to 30 to 50 prescriptions are never even filled if the patient just decides I'm not even going to take this medication. Of the 50 to 70 that are sent to the pharmacy, only 50 to 66 are actually picked up by the patient, and then of those, only 25 to 30 are actually taken properly, and 15 to 20 are then refilled as prescribed. So it's a huge issue. If you can think about this, it's mind-boggling, right? How many patients are not taking their meds. So at any given time, 50% of patients are just non-adherent to their medications, and we have to find ways as pharmacists to improve the way they're taking their meds. So that's where we're going to talk about motivational interviewing. Now, when we talk about motivational interviewing, we're really talking about doing it, kind of abbreviated, because you don't have a lot of time. You don't have 15 or 20 or 30 minutes like you would if you were, let's say, a psychologist that had group time with your patients, right? So we only have a few minutes. So you want to do your motivational interviewing quickly. And that's kind of those are kind of the techniques that we're going to be teaching you today. So we know medication adherence is a challenge. We've just seen the data. Simple counseling, telling the patient, take your medications, does work for some patients. Just like if I told you, you need to study so you can become a better pharmacist, that could work for some of you, but for some of you, it won't work. So, for a lot of our patients, the reasons for not taking their medications correctly are very complex, and we need to figure out what those are. So motivational interviewing is a proven technique with substance abuse issues, so with drug addiction, with alcohol abuse, and could be helpful for medication adherence as well. There's some data to support that it could be helpful. So motivational interviewing should be a part of your toolkit as you're trying to improve adherence for your patients. So what is motivational interviewing? It's really a counseling technique which tries to elicit the patient's reason for change, the patient's motivation, right? So it allows the patients to think through their decisions and motivations. It's based on the idea that the patient's own motivations are more powerful than the healthcare professional. So I could tell you, you need to be a better pharmacist so you can get a residency, so you can get a great job, so you can be respected in the profession. But those might not be your reasons. So I have to figure out what it is that makes you tick, that makes you want to be better, and then kind of guide you in that direction instead of telling you what I think you need to know, because those motivations might not be your motivations. So the principles of motivational interviewing really include, building a partnership with your patient. So, the patient is the expert on themselves. So you want to ask them permission. I want to help you make this change. Would that be okay? The patient is autonomous. So the patient must make their own decision to change. You need to respect the patient's decision without judgment. So they don't want to make a change, that's fine. You can continue this and be non-judgmental by saying, that's fine if you're not ready to make a change right now. Let's talk back in a few months and see how you're doing at that point. Then you have evocation. You want to evoke the patient's own motivation for change. What makes you want to make this change? Trust the patient to be motivated for something. And it could be something really simple, right? I want to be a great pharmacist so I can make a lot of money. Okay, that's fine. That's your motivation. Now let's use that motivation to help guide you so you can actually graduate on time, things like that. So you're kind of using people's motivation to guide them towards change instead of your own motivation. So, as with any counseling technique, empathy is very important. Empathy is especially important in motivational interviewing. You want to use open-ended questions. You want to come from a place of genuine compassion for the patient's point of view. I can see how hard it would be for you to keep all your meds straight. What you're really saying to me, what you're saying to me is really important. Please elaborate a little bit more. Okay, I hear you. You mentioned your wife. How does she factor into your decisions? You're kind of trying to, really tell them, I care. I want to hear your point of view. The goal is to remove any judgment from your conversation so the patient really feels comfortable opening up to you about why they're not taking the meds as prescribed. So you want it to be a non-judgmental environment and say, you know what, normalize it even. Just say, you know what, I know how hard it is to take your meds. A lot of my patients, including myself, struggle with taking their meds on time. So I completely understand. Please tell me why you're not able to take your meds. What's it like for you? So you're telling them there's no judgment here, and there shouldn't be, because if any of you have ever taken medications or have tried to make any change, like lose weight or to improve your study habits, do your readings before class, you know how hard it is to make changes, right? So think about it from that perspective, and that'll help you build a little bit more empathy for the patient. Then you have this concept of self-efficacy, which is, past failures or big changes might lead the patient to think that they're not going to succeed. So if, oh, I've never lost 30 pounds in my life, so why do I think I can lose 30 pounds now? And then it becomes really daunting. So for example, if you never do the readings before class, and then somebody said, from now on, you're going to have to do all your readings before you come to class, you're going to be really daunted by that. You're going to say, I've never done it. So you want to highlight the patient's strengths, and you want to say, I do think you can succeed. And you want to say, okay, have you ever, do you like to read? How do you study for exams? Think about it on the flip side. If you studied the same way that you studied for the exams before class, would that be too daunting? Have them take things one step at a time and say, you know what, you don't have to study, you don't have to do the readings for every class. Is there one particular class that you want to start off with? So you want to do those small steps for your patient, but you want them to believe in themselves. So just kind of having their own confidence that I can do this. I've done this before. You want to roll with resistance. So certainly, you know, telling your patient that, it's okay. Change is, resisting change is difficult. I can't imagine having to take your meds 4 times a day. I can't imagine how hard that has to be for you. I completely understand that this change would be difficult for you. And just kind of put them in the same position you're in, which is, imagine that you have a favorite thing to do and suddenly somebody says you can't do it anymore. Are you going to resist that change? Are you going to say, no way, that's not fair. I want to do that. I like to do that. So it's the same thing for your patients. And you might have to change your technique. So if you're going in one direction and you start noticing that your patient is really starting to get uncomfortable, really starting to resist what you're saying, pull back and say, I'm going to try a different way of doing this. The next thing you want to do is develop some discrepancy, which is kind of, say, okay, what are the pros of taking your meds on time? And then what are the cons of not taking your meds on time? Let's talk about that. So you said you want to fit into your little, black dress, so you want to lose some weight. But on the other side, you say that you love eating cakes and you love eating cookies. Let's talk about those two opposing kind of factors and then see if we can move you towards the change so you can fit into that black dress that you really want to. And from an adherence point of view, you can really kind of ask them, okay, what are the pros and cons of not taking your meds? How are things going to change if you actually did take your meds on time? What are some improvements that you can see? So in summary, when you're using motivational interviewing, really kind of, genuinely express empathy. So as you're practicing for a class next week, really kind of think about, how can I be empathetic to whatever this patient is going through? Communicate respect for the patient and acceptance of the patient's decision. Be non-judgmental. It's okay that you don't want to make a change. It's okay that you don't want to take your medications on time. Listen rather than give advice as much as you can. Listen to the patient, find out what makes them tick, find out what's important to them, not what's important to you. Expose discrepancies between the patient's goals and their current behavior. So I hear that you really want to lose weight so you can fit into the black dress, but then on the flip side, I hear that you really do love your cakes and cookies. Let's see how we can move you towards change. Be open about a desire to help the patient change. I want to help you fit into that little black dress that you really want to. I want to be there for you. Please tell me how I can help you. Please tell me what are some ways that I can contribute to your success. And then you want to support self-efficacy and optimism. You've lost 10 pounds in the past. You did mention that you've been able to count your calories and you've been able to lose weight that way. Do you think that could be a technique that we could use again for you? Because I know you can do this. You've done this in the past. So you're giving them that confidence. I know you can do this. And all of these techniques, if you use them correctly, you can really kind of help your patient along. Okay. So the next video that we're going to watch is a video that kind of depicts two ways to address medication adherence. I want you to really kind of watch both of them, have some reflections in the back of your mind as to, okay, which one worked better, which one didn't work as well. And kind of, what you liked about each or things like that. Just start jotting them down, because one of the assignments you're going to do is actually write a reflection on this video. So you want to kind of watch it carefully. Watch it before class as well, because you'll be doing this with the TA actors next week. So you want to have an idea of how to do this motivational interviewing, because it's not as easy as it seems. Okay, so I'm going to play this. Hi, Mr. Smith. How are you?
How you doing, Dr. Gupta?
I am good. I'm so glad you came in for your 6-month follow-up today. How have the new diabetes medications been working for you?
Well, so far so good, I guess. But I haven't really noticed any big changes, though.
Okay. Have you experienced any side effects? Anything that seems off from the medications?
Well, I don't know if it's the meds or not, but I've packed down about 10 pounds since my last visit. So, I don't know.
Okay. Well, I'm so sorry to hear that. That's definitely something we can address. I was looking at your refill history in my files, and I noticed that you haven't been picking up your meds on time. Is it okay if we talk about that for a little while?
All right, then.
Okay. So, you've been a little late in picking up your insulin and metformin the last 3 or 4 months. And as you know, taking your meds correctly is key in getting your diabetes under control. Unfortunately, uncontrolled diabetes can cause blindness, kidney failure, heart attacks. So it's definitely something we need to get under control because, that's my goal for you, is to improve your health. How does that sound to you?
All right.
Okay.
I'm trying my best. But obviously sometimes I don't always take my meds like I'm supposed to. Frankly, I don't think it makes a whole lot of difference, but I guess I could do better for you.
Okay. Well, that makes sense. Can I offer any ways to improve your adherence to these medications? Would any tools be helpful to you?
Sure, I guess.
So, there's a few things I can offer. One of the things that we can do is set up a phone call, which actually reminds you to pick up your meds on time. Would that be helpful? The pharmacy can just kind of call you on a monthly basis and tell you it's ready for, your refill is ready for pickup. Would that be helpful as a reminder?
Sure, that might help.
Okay, well, good. I will set that up right now. Also, we do have some pill packs over the counter, which can, they're kind of these little pill boxes, which can help you remember to
Yeah, I've
take
seen
your
them. Yeah.
medications. That might be helpful. I know you're taking like 4 times a day medications. And so if you can organize
Hmm.
them in these pill boxes, I think that would help with just kind of remembering, oh, I haven't taken my lunchtime dose or I haven't taken my evening dose. Would that be helpful?
Sure, I'll take a look at them.
Well, great. You know what? I will show you what kind of tools we have available for you, and that'll be a good plan for us to just kind of get everything in order and get those labs better. Because your labs are a little high, and I'd like to get those down, and that'll really reduce some of your risk of the complications of diabetes. How does that sound?
All right.
Okay, well, good. Thank you so much for coming in, Mr. Smith.
All right. Thanks, Dr. Gupta.
Hi, Mr. Smith. How are you?
Well, so far so good, but haven't seen any big changes yet.
Okay, well, I am so glad you came in for your 6-month follow up. How have the new diabetes medications been working for you?
Well, I think all right, but I've packed down about 10 pounds since I started them, and I don't know if that's the meds or just me.
Okay. I'm so sorry to hear that. That's definitely
Hmm.
something we can address. I was looking through your medications and noticed that you've been a little late in picking up your insulin and metformin the last few months.
Mm,
And I just kind of wanted to talk to you today about your diabetes medications and how you feel about taking them. I've worked with a lot of patients who struggle with taking meds every day, and I know it can
yeah.
be a really difficult thing to do, even just from my own personal experience. Some of my patients struggle with remembering to take the meds, or they just don't
Hmm.
like how they feel after taking the meds. What's it like for you?
Well, I'm really trying to do my best, and obviously, I don't take them all regularly like I'm supposed to, and frankly, I don't think it makes a big difference. But I guess I could do better for you.
Okay. Well, you know what? That makes sense.
Hmm.
I don't have an agenda for myself. I just
Hmm.
have a goal for you. We did get labs from you last week, and I did notice that your
Mm,
C lab was really still high, which means we haven't really been able to get it down. So that,
yeah.
I just want to see if there's anything I can do to, help you take care of your health better, to help make some changes that might help you get there. How does that sound
Hmm. It
to
sounds all
you?
right. Yeah.
Okay. Well, you did say that you feel that you could be doing better. In what way
Yeah.
do you feel you could be doing better?
Well, I could be taking my meds like I'm supposed to. That
Okay.
that 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 I think I could do better on that. I know that.
Okay. Well, let's talk about, what are some reasons that you're unable to take your medications on time?
Well, I'm gonna be honest with you that sometimes I just forget. It's I got to take some of them 4 times a day, and time just gets away from me, and I forget, and next thing you know, it's I missed it.
Okay. Well, that makes
Yeah.
sense. I imagine it's very hard to take, meds 4 times a day. What are other reasons that you can share for not taking your meds, as they were prescribed?
Well, I've gained this weight since I started this, and one of the things is I'm supposed to be losing weight, and it's just kind of frustrating, and I'm feeling like I'm more out of shape than I was before.
Okay. I'm really sorry to hear
Hmm.
that. What are some good things about taking your medications on time?
Well, they said I'd be healthier if I took my meds like I was supposed to.
In what way did they say that you would be healthier?
Well, with the diabetes, as one of the problems is it makes me really tired all the time, and that taking my meds right, should help with that. And then also it's supposed to, help with, I get the blurry vision sometimes too, and that's supposed to get better also if I take my meds like I'm supposed to.
Okay, well, those are definitely some
Hmm.
great health benefits to getting your diabetes under control. From a personal just kind of point of view, what are some other reasons for getting your diabetes under control?
Well, the wife and I, we like to travel and get out, and we want to see all 50 states. That's kind of our thing. But I know if my diabetes isn't doing well, I won't be able to travel real well, and especially drive. So I need to get it under control if we want to do that.
Wow, that's wonderful. I love to travel as well,
Hmm.
and see the U.S. and so many wonderful things to see that I
Yeah.
haven't seen yet. So, what other reasons do you have for getting your diabetes under control?
Well, you know, my dad had the diabetes, and he died of a stroke, a while back. And, a lot of people have said that, it probably was the diabetes that caused him to have a stroke. And I'm starting to get to be about the same age that he was when he passed. So that's kind of concerning to me.
I'm so sorry to hear that. It sounds like you're concerned
Hmm.
about also having a stroke. Is that correct?
Yeah. Yeah. It's kind of always in the back of my mind.
Okay, okay. Well, it looks like there's so many reasons.
Hmm.
Taking care of your diabetes, is very important to you. It looks like there's so many reasons for you to make a change, and there's some
Yeah.
reasons for not taking your medications, including side effects. What do you think the next step would be for you to kind of work on your health?
Well, probably the first thing is just take my meds like I'm supposed to.
Okay, well, you mentioned that you forget to take your medications on time. Have you tried any tools to remind you to take your medications?
No, not really. I didn't really know that there are any.
Okay. Well, what do you think would work best for you? Do you prefer a low tech option or do you prefer something more high tech?
Well, I'm not one of them real high tech kind of people, but I do use a lot of apps on my phone, and you know, they got all them crazy apps. They got an app to help me that's on my phone.
There's definitely some apps. I can
Hmm.
definitely suggest some things that can remind you to take your medications on time, that can even remind you to check your blood sugar
Hmm.
on a regular basis.
All
Would
right,
those be helpful for you?
that might be pretty helpful. Yeah.
Okay, well, you
Yeah.
know what? Let's get something
Hmm.
installed on your phone today. I do
All
have some
righty.
suggestions. Also, you mentioned that your medications have caused you to gain weight, which is a side
Yeah.
effect of the insulin that we started. We could try some ways to offset the weight gain. Would you be willing to try some strategies?
Yeah. Anything be helpful right now.
Okay, good. So, let's work on a plan that actually works for you and your lifestyle. So, what
All
are some
right.
ways that you could reduce gain? What are some things that could work for you?
Well, a lot of people say, get off your butt and walk around a little bit more. Maybe that's something I could try.
Okay, well, great. On a scale of 1 to 10, with 1 being not at all and 10 being completely, how ready are you to start walking in the evenings?
I'd say probably around about a 7.
Wow, a 7 is really good. Why a 7 and not a
Mhm.
1?
Well, I've been kind of thinking about it, and I know I got to get moving. I got to get motivated, but I'm almost there, so that's why I'm thinking that 7 instead of a 1.
Okay, good. That's great to hear. What would happen for it to be an 8 or a 9?
Well, somebody'd probably have to kick my butt and get me moving.
Oh, I completely understand. Does anyone come to mind?
Oh, that'd be my wife.
Okay, good. And has your wife been involved with walking or with any exercise with you in the past?
We used to do it a while back, and we've done it here and there. So yeah.
Okay, good. So, so having your wife will definitely help you make this
Hmm.
lifestyle change. How much time can you take out of your day to walk? What do you think?
Well, we probably could start off with 15 minutes, a half hour, something like that.
Okay, great. So this is
Yeah.
really a great first step. Are there any other small steps that you can take?
Well, probably not. I want to take this real slow, and I don't want to screw this up. So I want to do the little steps. I think this is good to start with right now.
No, I completely agree. Just taking small steps is great. On a scale of 1 to 10, how confident do you feel that you can make these changes?
I'd probably say I'm probably at a 9. I think I'm ready to do these little steps. Start to get the ball rolling. I think I'm at a 9.
Okay,
Yeah.
I completely agree with you as well. I think that you've done this in the past with your wife, so there, you know, that so you know you can do it. You've both kind of been, you know, you've gone to walks together, you've exercised together. So I think that
Hmm.
that's something you can start back up. You're also good on your phone. You've used apps in the past, so helping, you know, using an app to
Hmm.
remember is something you can do. So I really do think these changes will help you improve your health.
I
Let's
hope
meet
so.
back. Yeah,
Hmm.
let's meet back next month and see how things are going, just so we can both touch base and see if there's any other things I can recommend or other things that you think of. How does that sound?
I think that sounds like a plan.
Well, good. It was really good to see you, and I wish you the best of luck. And you can always call me if you know, need anything or, you know, want any more suggestions.
All right. Nice to see you too. And I'll see what I can do. All righty.
Okay, great. Thanks. Bye bye.
Thanks now.
All right. So as you see, there were, you know, two different kind of techniques that the pharmacist used. So you had example one and example two. I want you to really kind of think about example one and example two. Think about what really was a better way of doing things. Think about, you know, how the pharmacist, you know, included the patient or did not include the patient. Really kind of reflect on that. I'm not going to tell you which one was a better technique. That's up to you to decide. You know, whether you thought that example one was better or example two was better, that's up to you. Kind of you be the judge, and look at those techniques, and then these are the techniques you're going to use next week in trying to elicit the patient's kind of reasons for wanting to improve their medication adherence. Okay.